Hello, everyone. My name is Karen Carnabucci. I am in Lancaster, Pennsylvania, and I am the founder and main instructor for the Lancaster School of Psychodrama and Experiential Psychotherapies. And today I am super pleased to introduce and have you get to know Adena Bank Lees, who is a psychodramatist and social worker based in Tucson, Arizona. She will be our guest presenter along with myself on February 27th when we will be teaching about trauma responsive psychodrama, a step beyond trauma informed. So Adena is a super dear friend. She is an innovative therapist. She's an innovator in general. She's an author. She has tons of things to share. I'm not going to go on and on about this because, well, she has tons of things to share. So Adena, welcome.
Thank you so much, Karen. Thanks for having me. It's very special to be able to spend some time with you and talk about this and educate some people. So it's something we both love that I know
Yes,
to
and
do.
we go back a long time, don't we? Yes. So let's start with this phrase, trauma responsive in general,
Right.
and how that is different from the trauma informed phrase that we hear so often today,
Okay.
and how it might be related to psychotherapy in general or psychodrama, which is our specialty in particular.
Great. All right. So trauma informed means that I am aware and I have knowledge about the Substance Abuse and Mental Health Association's 6 principles of how to pay attention and know that trauma impacts my physical health, my emotional health, my mental health, cognitive health. Then if I didn't say spiritual health, I mean spiritual health. And I'm informed by that, so I know what's going on, but it doesn't include that I actually tailor my style or my interventions for clients based on that. So, give you an example of that. If somebody is in private practice, I know about those things, but I have an office that is not inclusive, for example. That maybe I only have pictures, and because we're two white women speaking, I'm just going to use that. I only have pictures of white people, and I don't have anything inclusive of other cultures in my office. That's just an example of trauma informed but not responsive. Responsive would be I pay attention to what's in my office for things that would be resourcing or supportive or grounding or relating for people rather than for either alienating, making them feel different, etc. Bottom line. Trauma-informed psychodrama in particular, I think is critically important. And I want to give a credit where credit is due to Dr. Kate Hudgens and Francesca Toscani for coming up with the model of the therapeutic spiral model of psychodrama, which really was the first piece, I believe, to address how trauma impacts the nervous system and how we have to change some of our psychodrama techniques and interventions to accommodate people. So I'll give you an example of that. My primary trainer was trained by Zirko Moreno back in the 70s, classical psychodrama. And my primary trainer for my certification, which was back in the 2010, 12, something like that, said to me, when you work with people, you have to work really fast because you can't let them think. So you have to work really fast and you have to just get them on their feet and keep them doing and keep them doing. That is neither trauma informed nor is it trauma responsive. But that's how we used to do things. So
Right.
now, when we know, since the 1990s and the decade of the brain and the explosion of all the research that's happened, and the pieces of interpersonal neurobiology by Dan Siegel and the stuff by Bessel van der Kolk, I'm giving names for people so that if you don't know these names, you can go research and look these people up because they're the big people in the field that are worth looking at in terms of the neurobiology of trauma and how our interventions need to be informed by this. We're also talking about Stephen Porges for polyvagal theory. We're talking about Pat Ogden for sensory motor psychotherapy. We're talking about Peter Levine for somatic experiencing. We're talking about Francine Shapiro for EMDR. These are all methods that take that into account that are trauma responsive. So I did 5 hours a group today. And what I do to start, I do three 50-minute groups and I did one 2 hour group. And I start out every group trauma responsive. I don't know everyone in that group because there are new people coming in and out all the time. It is critically important that I introduce myself. How do I hold myself when people walk in the room? They don't know who I am. The unspoken expectation is they're going to be vulnerable with somebody they don't even know who's in an authority role. Do I even know what that is like? So if we want to talk about, have I ever been in that spot? Can I empathize with that? So I am very big, and I've been teaching this for 30 years, that if you are any kind of therapist and you have never been in the client role and you have never made the first call to someone or sat in the office waiting to be called in or done an intake, sitting across from somebody and having to tell them your life story and be vulnerable with them, you have no business in being a therapist. And I feel very strongly about that because you have no idea what is happening for that person and inside that person's nervous system. You can't be trauma responsive because you have no clue what's happening. So I always introduce myself. One of the first things I say is, I say my name, of course. I say, I'm a therapist here. I'm a specialty therapist here. That's what I do at this particular treatment center. This is my specialty area. I describe it. And I say, I am very open to any questions or comments that you have of me, personally, professionally. I have boundaries. And so if you ask me a question that I need a boundary with, I will let you know. What do you need to know about me to help you feel just a little less anxiety of sitting with somebody you don't know? Right off the bat, what am I offering? Okay. I'm saying you have choice here. So choice is a trauma-informed principle. How do I enact that? I pay attention that there is a power dynamic in the therapy. And I'm already saying, I know it's there, and I know just meeting me, and in psychodrama terms, I am acknowledging and I am respecting and honoring somebody's what we call warm up, which is, I don't know you. I don't feel comfortable with you right away. I don't want to open up with you right away. Rather than, hey, I'm a trustworthy person. You should be able to open up with me right away. That's insanity. Absolutely insane. So that's just a specific example. And what we're going to be doing in the workshop on the 27th is we're actually going to learn this experientially because I am going to be teaching the participants as we are doing a group. And so you're going to see it in action and you're going to experience yourself as the client in the group, not having to divulge personal information if you don't want to, because this is a training. And what I do is the way I teach is I'm directing, and I will then say, okay, here is the director's soliloquy. This is what I'm thinking. This is how I make the clinical decisions. And this is going to be what I do next. So that as you're experiencing it, you'll learn why I do what I do. You'll experience what I do. You'll experience it in the group. And you'll have, I hate to use that word again, but you will have an embodied experience of this rather than a lecture that just goes to your left brain and it's not applicable.
I think that's really important because so many times it seems that in modern training experiences, it's a lot of information being tossed at the trainee with not a lot of time given to letting the trainee take in the information and experience it and understand it from the inside.
Right, exactly. And in the 2 hours that we have together, I don't have time to support people in actually practicing as a director. That is something that it goes to more in-depth psychodrama training, where you get the information and then you can actually practice and apply the skills there with a trainer present to be able to help and guide you. This is, again, it's online. And we can do practice online. That's not a problem anymore. We know how to do that now. Thank you to COVID. And thank you to Daniela Simmons, who started Teledrama, which is, our way to do psychodrama online that helps us to learn how to do that. But no, this will be an experience, and then we'll have questions and answers.
Yeah.
Yeah,
Which I think will be very important. And one of the topics or questions I hear about from my train is how do we transfer experiential work onto teletherapy? And there are ways to do this,
yeah,
and
very
ways to
much
do
so.
this very well. So we're not just talking heads, but we're
Correct.
actually drawn into an experience that can be really powerful.
Absolutely, yes.
So it'll be a really good demonstration on how to do that.
Yes.
Yeah.
And how to do that simply, because I am not teledrama trained or certified. And with that certification, Daniela teaches you how to use all the tools of Zoom to be creative and bring in some of the psychodramatic techniques, like they call it surplus reality, which is creating with your imagination. So bringing in a picture of a picture of a beautiful living room and snow is falling outside and there's a fireplace and there's soft music playing, and you feel like you're there. You're on a screen, you're in your own home, but you feel like you're there. I don't have those skills. I am going to do something that doesn't involve necessarily the technology of that, but the leading of the experience in action, that we can do it safely or safe enough, knowing that we're not in the same physical space, but how can we use the virtual space in a safe enough way? And that is a word, a term that I heard and use a lot that really makes sense to people in terms of trauma responsive, because many of the clients I've worked with over the 40 years I've been doing this is I've said, I don't have a safe place. There is not a safe place for me. Stop asking me where it is. So I will say, check in and see if it's safe enough in your body with your parts of self in this room with these people at this moment in time. And psychodrama is about this moment. So I want to really bring it to this moment, which brings in mindfulness at the same time. And check, is it safe enough to you for you to say X or for you to do Y in this moment? People can usually say it is or it's not, rather than, well, there is nothing. And so they have a different experience, and it doesn't put so much pressure. It's not an all or nothing term. That's really important when we talk about trauma responsive, is to get out of all or nothing terminology.
Yes.
Mhm.
And to make things very focused as opposed to talking generally.
Yes.
I want to mention and bring up something that I think relates so much to what you're doing, what we're doing, what we're all doing, but especially what you're doing. Um, the word trauma, the experience of trauma, the treatment of trauma. It seemed like when you and I started work many
Yeah.
moons ago, trauma was focused on the individual. The individual came to us, was carrying trauma. We used our
Right.
skills to
Right.
work with that particular individual on something that happened to them at some point in their lives.
Yes.
Still very valuable,
Yes.
right? However, in more recent years, we have become aware of collective trauma. This
Yes.
idea that large groups of people, countries, many
Nations. Yes.
countries,
Yes.
are experiencing on one level or another trauma, whether it is war, whether it is a flood of refugees, whether it's COVID, whether it is huge political anxiety about what's happening in the country, that now we are becoming more acquainted with this idea that the collective is experiencing trauma all at the same time. And I'm wondering how we integrate trauma responsive care in a collective setting, or with people experiencing collective trauma.
Well, I think that's a great question and a great point, and thank you for bringing that up and bringing that out. And I'd like to give, I think, a little bit more of a broader definition of trauma, because that word can be very much overplayed also.
Mm-hmm.
As we both know, as can psychodrama, and psychodrama can, that word can be misused. And so I do a lot of dispelling myth where I work about what psychodrama is. And so I'm going to say that first, and then I'll go to trauma. Just to say, psychodrama in itself, the way that I describe it to people that lessens their fear and anxiety is psychodrama, the definition literally is the soul in action. It's not acting class. It's not improv games. It's not reenactment of trauma where I have to relive something traumatic for me. And there are no have tos. There's never a have to. It is always are you willing to? Am I willing to? That's the question. So psychodrama is about practicing new behavior. Simply. And I get to choose what new behavior, which includes thinking, self-talk, I am ready to practice. For me, it's that simple. And really, I just feel that people's anxiety go down. Otherwise, people have lots of, oh my God, I have to go back to my childhood and I have to replay X, Y, and Z, and I have to act out something. And no. So I want to say that. The other for trauma is trauma. What we know now is it's not necessarily the event that happens. It's about how the nervous system interprets, is impacted by event or omission of. So we're talking about neglect versus overt abuse, for example. Starvation versus overfeeding. I'm talking about the extremes now. And we have to put in there also, and I always think about Bessel van der Kolk talking about the study that happened after 9/11, where when the planes hit, people ran in the direction of what they considered was home in their heart. So they were in fight and flight or freeze. We know those, right? So the people who were running, who had the flight response, their bodies took them in the direction of what their bodies considered home was a safe refuge for them. If they were able to get there, and there were other human nervous systems there who could literally hold them, physical, safe, nurturing touch, and help them regulate, help them breathe with, feel all the feelings, shake, do everything they needed to do. Those people in general did not show signs of PTSD 6 months later. They had acute stress, of course, because it was a horrendous thing that happened. So nightmares, trouble sleeping, intrusive thoughts, first 3 months or so, yes. But did it last 6 months plus, which is a diagnostic criteria for post-traumatic stress disorder? No. The people who were not able to get that comfort, to get that regulation, to get that safety, those are the people who ended up more with the post-traumatic stress disorder. So that's really important to notice, because something terrible can happen and it doesn't mean, oh, now I'm going to get PTSD. Asking for help, having a safe enough support system, being able literally physically to be held, and for people to hold space for you to have all your feelings, that can mitigate the quote unquote traumatic effects of events. Okay. So how do we do trauma responsive in the collective? The first thing is to name it. Psychodrama says make things overt. So let's name it. Yeah, it's happening. People's nervous systems are totally dysregulated. People are so anxious and depressed and obsessing and ruminating. Of course they are, because, and I can just say in the United States right now, because this is where I live, I don't know about other countries. We're scared. We have every right to be scared because there are masked people who are coming up in cars and just getting out of cars and taking people off the street and taking them, and we never see them again. Of course, it's scary. There's a lot of reporting now about children who are terrified of anybody in a police uniform or who looks like a policeman because they're afraid that somebody's going to take them away or going to take their parents away because this is what they're seeing and what some of them have experienced on a playground that they just came to a school or something. This is affecting all of our nervous systems. So trauma responsive is acknowledge it from the get-go. Because people feel crazy. Why am I so upset? Why does it? This is happening to all of us right now. It's there as a baseline. And then you have your own biography on top of that and mixed in with that. The other is, like I said about choice, that's such a big one, is to continue to allow people to have as much control in what they share, in how they sit and where they sit, and the lighting of the place that they sit in. I mean, everything you can give them some kind of control over in the environment that they're in when they're working with you as a clinician, that gives them more safety. For you to be as human as you can be, not sharing your own stuff because it's not your therapy session. That's not why you're there. But for you to be human and professional, which means consistent, authentic, very clear and focused in terms of boundaries, appointments, cancellation policies, availability, everything that goes into that. Consistency and clear boundaries equals safety. So I'm just talking about the holding space. That's how you set that up.
Yes. And I want to add, or I suppose have you say it. I can say it too, I suppose.
Yeah, let's both say it.
Let's both say it. The value of sociometry, which is not a well-known word in the general therapy or coaching populace.
Right.
But the sociometry, meaning the art of relationship building so that we can feel connected to each other rather than apart in our own trauma space. And how important those skills are to support people.
It's the foundation of everything, Karen. We can both say that. It's the foundation of everything.
Mm-hmm.
And the sociometry we have with the person, which is the relationship. What kind of relationship are we building with the client? And then if we're working in a group, and I only do group now. I used to do individual and group. So can I build a therapeutic alliance with a client? And what do I need to do that? We're talking about some of the basics now. And we've already said some of those things. And if we're working in groups, again, something that the clients really enjoy in my groups at the place I work, it's so fun because it makes it light, but people know they're not alone. So we do one foot in. If somebody shares something, 1 foot in means I relate to you. 2 feet in the circle means I really relate. And I get up and I dance and I put my hands up and I dance around means you're telling my story. So when someone shares something and I say to them, would you like to know if the group relates to you? And my groups all did this today. Yes, please. I feel so alone. Show Jane so-and-so how we relate. And people put feet in and dance around and everybody just starts chuckling. So we're talking about difficult things and at the same time go, we're not alone. So to build the group cohesion, which also increases safe enough for people. The other thing that I noticed too is when I talk about being authentic and being human, I shared today, I really discern my self-disclosure. I'm very careful about self-disclosure. And when people are new in their first 1, 3, 4 years or so, I really suggest hold off on the self-disclosure, get a lot of consultation about what's appropriate and not. My guidelines are usually if I have experience, strength, and hope to share with this person or the group, and I have some distance from that, and it's not for me. I'm very clear that the motive is it's in their best interest. It's for their healing process. I'll share something about myself. And I chose to do that in group today. And I found I was feeling alone. I said, okay, group, can you show me who relates? And people got up and they were laughing and we were dancing around. And somebody came up to me after group and said, thank you so much for that because I just got here. I'm new. And you sharing something and being human set the tone for everybody else, for me to be able to be vulnerable. I've been doing this almost 40 years now. So somebody who's new, that takes time to know kind of how to do that, when to do that, et cetera. So the consultation supervision piece is so critically important.
Yeah.
I hope that was do you want to add anything to that? Sociometry being the art of relation and connection.
Yes, so there are, of course, sociometric activities that are well known that we teach. Both you and I teach those things. And I would say, maybe you'll talk a little bit more about that on the 27th, but I would say how important those activities are because when I hear you say, oh, yes, everybody got up and danced, I'm imagining that some newcomers to experiential work would go, ooh, how'd that happen? That's kind of scary. Oh, no, you mean I have to get up and dance? But what is wonderful about these sociometric activities is they warm people up to become more and more spontaneous.
Yeah.
So that this is not fake acting or I guess I got to do this to be a good client. People are naturally warmed up to want to participate. And one of the things that I hear about a lot in my corner of the world is, especially from very new therapists, is I couldn't get anybody to talk in group.
Right.
Oh no, they don't even want to talk. They sit there being silent, and I sit there being anxious.
Do, yeah.
Right? But
Mm-hmm.
these activities, step by step, tier by tier, support people in being present.
Yes, very much so. Very much so. Yes.
In my
And
group, we talked about spontaneity today and
yes,
building that sense of spontaneity, which is wanting to bring yourself forward in a good way.
yes. And spontaneity in what I learned in the psychodrama definition, spontaneity is an adequate response to a new situation and an adequate and new response to an old situation. So I don't do the same thing over and over and expect different results.
Yes.
And I think my environment, even though I have new people coming in all the time, my environment in working in a residential treatment center, there's a culture there. So yes, some new people go, "Who is this woman like doing this dancing?" And she schleps around a suitcase with these things in it, like I don't even know what they are, which they're scarves, because you can't be a psychotraumatist and not have scarves. And I also have tons of stuff from the dollar store, so I get to do my retail stuff. But anyway, so yes, these exercises help people, and they see,
We did Year of the Snake and Year
okay,
of the Horse today.
wonderful, exactly. So now you're showing concretization, which is we make the intangible tangible. We make things concrete.
That's right.
So we can get all the levels of the brain activated in psychodrama so that when we leave the session, we can apply what we've learned because it's already in all the areas of our brain. It's so exciting. I just love it. I mean, we could talk for hours. I know Karen and I could talk for hours about this. So spontaneity, just to say one last thing is that people can feel safe enough to get up out of their chair.
Yes, I like that. Yes, safe enough to get out of their chair and into genuine action.
Yes.
Yeah, I love that. We could talk for a long time, um, and we're not going to do that, at least not
Okay.
right now. Um, so I want to thank you for talking to us about being an authentic therapist, which I know you are,
Thank you.
and to talk with us about trauma responsive therapy and psychodrama, and invite you to come to our workshop on February 27th. It's online, so you can come from anywhere and join us and learn. Um, and maybe we'll even have Adena back another time, because one thing that we have not discussed today, is that Adena is also an author who has written a book on covert emotional incest and is right now revising that book and also creating a workbook on that topic, which is a whole nother area of innovation, in my opinion. But I wanted to mention it before we close
Thank you,
and
Ken.
let people know about it.
Thank you so much. Yeah, I would like to post this video on some of my social media so people can do that. You can go to my YouTube channel, Adena Bank Lees. I have lots of videos on there, and you can learn what covert emotional incest is if you don't know what that is. There is a book out on Amazon with that title. I am revising and updating that text. It was published 8 years ago, and that will be out spring of this year with a special section now for therapists. There'll be clinical vignettes, and there's a whole section on ethical suggestions and questions and stuff like that. The workbook is actually out. It was published February of last year, and both are available through Amazon. And I'm looking at other places to also place that book so that you have other choices other than Amazon to purchase it.
Wonderful, wonderful. Thank you, Adena. I am looking forward to being with you again later this month
Thank you,
and
Karen.
learning from
Same
you
here.
and having other people learn from you as well. So, looking forward for more.
You got it. Take care.
Okay,
Thank you.
bye bye now.
Bye-bye.